about this partnership that we're engaged in and the great work that's going to be going on in our community. So Villa Maria is proud to work with Say Yes Buffalo and with the Healing Hub initiative. Villa is a college where we really place a lot of importance on our engagement with our community. We are a college that feels very strongly about the potential of all the young people in particular in our community and what they can achieve. And we want to work as cooperatively as we can with any organization that is really committed to helping people succeed. And we know that our young people here on campus have a lot of mental health needs. They have a lot of needs just dealing with the obstacles and challenges that they face in their lives. And many of them are coming right from our backyard, right from this community right here. And we're a very diverse community at Villa, and we know how important it is for our students coming from a variety of backgrounds to have people they can turn to who know what their experiences are like, who look like them, who can relate to them. It makes a huge difference. And so that's why we are very excited about opening up our doors and partnering in this collaborative because this is so needed here in Buffalo. It's so needed to make sure that our neighbors, our friends, our young people, anybody who needs, help and support, dealing with a very, very complex world right now, they can find it and it can be effective for them. So again, thank you for being here. We look forward to all the work that we're going to do together, and I'm going to turn it over to my friend and a really incredible person in Western New York, Mr. David Rust.
Okay, good afternoon, everyone, and thank you, Matt. Villa Maria College is a special place. Matt's an equally amazing man who leads this institution, and I'm always happy to be here. It's got a great feel on this campus. So good afternoon, good to be with everyone today. Just to kick this off at the top, I'd like to thank United Healthcare. The announcement that we're going to put forward today doesn't happen without investment and investors that this community asked for, wanted, and was United Healthcare approached us saying, what can we do to help and what does the community need? And really grateful for your investment in our community, investment in Kelly and the Healing Hub, investment in our clinicians and what this will mean for our community. And doing it without us having to ask, approaching us. I think that was really special, and it's wonderful corporate leadership and deserves a special shout out. So thank you both for the investment of United Healthcare. There's one other partner who desired to remain anonymous, but with a similar desire to help communities of color and building clinicians of color. So a little bit about today's announcement as we step into this. I do think it's important that we talk about why we're here today and what precipitated this. We need to, after 5/14, we need to remember the lives that were lost, remembering those that were there to serve, who showed up regularly to help our community with counseling services, with food delivery, whatever was needed. And thanking the community for providing this feedback. And Kelly and her team were there regularly. That's what brought us here today, so that we can have proactive services in place that can help our community going forward. And this program was created in direct response to the community's feedback on what their needs were when it came to mental health services in community. Within our mission at Say Yes, we have a collective impact framework, and it's focused on services and supports for all the beautiful children in the Buffalo Public Schools. One of the core tenets of that has been mental health support. We've worked closely with many agencies to have a satellite mental health clinic in every Buffalo public school and on college campuses to meet the needs, the behavioral health needs of young men and young women in our community. And this is an opportunity to really double down on that support and with a direct response to help build the capacity of our clinicians of color that are stepping into this important work. We are really grateful for this new partnership with the Healing Hub, with Kelly in particular. There's an amazing team at the Healing Hub. They have incredible management and infrastructure and the capacity to deliver on this work and to really give back to those who are desiring for some of the mental and behavioral health supports that are needed and wanted and can really help somebody have the life that they want and need. I also think having increased access to clinicians of color in the city of Buffalo is critical and something that's not needed just today, but in future cohorts to come, so that we have the services that the community has asked for. Finally, I'd like to give a real note of appreciation to Kelly Dumas in particular. I've admired her from afar for a long time. She's an extraordinary leader, and she leads this work with purpose, with passion, and strong direction. So thank you, Kelly. You're welcome. We also have an amazing team at Say Yes. Amanda, I'd love to thank you for your leadership on this project and so much else that you do behind the scenes and in front of those. You're an amazing leader and woman. And I also like to thank our behavioral health partners. We've had 10 agencies that have stepped up to deliver mental health supports in the Buffalo Public Schools and on these campuses with a framework and a task force that is built upon this work for almost a decade so that everyone can have the mental health and behavioral health supports that they need and desire. So it's been a partnership effort, as always, but it always starts with a visionary leader. So next, I'd like to turn it to Kelly Dumas to say a few words. Kelly?
Thank you, Dave. Thank you very much. I want to start also with thanking Dr. G and Dave and Amanda would say yes, and definitely our United Healthcare partners. This would not be possible without the financial support and resources. You not only saw the need that the community, the outcry of us really needing more access to clinicians of color, but you put financial resources behind it to make this possible for us to address some of the barriers that limits our access to those who need us most. The May 14th tragedy really highlighted our need to have more access to clinicians of color. I was one of the first people responding on site that day for mental health support and was there for several weeks to come, as well as some of the clinicians who are here today. So unfortunately was able to see firsthand the need, the outcry, and how important it was for our community to have access to Black mental health professionals. And I also saw the challenge we had as a behavioral health system to meet that demand. So this initiative today is just the first step in us being able to address some of the barriers that created that. So me, like so many of us who were there, we have not forgotten. It has not been business as usual. We are looking for how we can continue to break down the barriers, how we can uplift our clinicians so that we can better serve our community. There are a number of clinicians here today who are a part of this initial cohort. Some are in community-based clinics. Some work in private practice. We need to make sure that we are providing support at all levels of the mental health system. Community-based clinics are very important, but not everyone needs services at that level. We need to make sure we are supporting our private practice clinicians so that those who need and want services in a more private, intimate setting, and they don't require a higher level of care, they are able to access those clinicians. So through this initiative, some of the clinicians will have access to specialty trainings, anger management, trauma training, family and couple specialist training. And also some who are in private group practice will receive support to be able to bill insurances. That's a big challenge with some of our private practice clinicians of color, being able to accept insurances. So we're going to provide the infrastructure support, the technical support needed to be able to do that. These clinicians will be providing some free services to the Buffalo community through the Healing Hub. That's going to be done in some of the schools through Say Yes. We have various partners throughout the community. We will have groups and individual sessions available. That's their give back for the support and access that they'll have to trainings and workshops and those types of things. So on our website, we will have a list of the trainings available, and also an important piece of this is building a database. One of the big challenges was, how do we find our clinicians of color? So we are going to work on creating a community where people can see where we are, how to access us, what our specialties are, and what insurances are taken. So we're hoping to have that launched this summer. I am going to now call up one of our clinicians in a cohort, Elise, to have a few words on what being a part of this cohort means to her.
Thank you, Kelly. I am very grateful for this opportunity. So my name is Elise Flunner. I am a mental health therapist, and I am the owner of my own private practice called Vines Talk Healing. And just like this program, it was launched as a result of the 514 incident. I was in community work prior to opening up my private practice, and I was already stepping out into something else. And then 514 happened, and then I recognized the need for Black clinicians in the community, and so I went completely in another direction and started working on opening my private practice. Here's the thing with that, though, this program wasn't there when I did that. I had no assistance. So, what I found myself doing was literally picking apart individual brains and piecing together the information that I needed to open up a private practice. And even with that, there were still things that I still was not able to do because I didn't have the training to do it. I did not have the funding to do it. I did not have the support, nor did I have the space to do it. So, it was a little difficult for me to get up and running fully. So a program such as this is so beneficial to people such as students coming directly out of grad school and not really having the desire to go into community work. And they have the desire to go into private practice, but they have no idea what that looks like. They have no idea what steps to take, and who to call. There's so many things involved with it. Supervision, making sure you have enough hours, all of these technical things that they don't talk about in school. So once you come out to do this on your own, you're kind of like lost. So a program such as this, especially dedicated to clinicians of color, is so necessary and so important. And I am so grateful to be a part of the first cohort of this program. And I just have great expectations. As Kelly was saying, I'm looking forward to the trainings that they're offering. I'm looking forward to being credentialed. I'm looking forward to so many things, things that probably would have took me a lot longer to accomplish without this program. So again, thank you. Thank you, Kelly. Thank you to the Say Yes program. And I just appreciate the opportunity. Thank you.
Thank you, Elise. I'm going to ask the clinicians who are present to come up, please, quickly as we close out. These are some of the clinicians that are a part of this initial cohort. Not all can make it, but thank you all. We are excited to do this work. Immediately following this conference today, we are going to have our first workshop on credentialing. So we're going to go into our workshop for those who have their practices and need to go through the process of being able to accept health insurance. We're going to start there and provide the training and resources and support to make that happen. And then we have a number of other trainings and supports that are scheduled and available. So thank you again to everyone who has made this possible. We look forward to serving our community residents. We are all here to do the work needed to make sure we're accessible and able to support our community. Thank you.